Hello everybody, this is my first learning or educational teacher lessons for you. I'm Dr. Nabil. I'm a professor of anatomy. I would like to teach you today's anatomy of the spleen. Spleen is here in Japanese means hizo, and in Arabic means طحال. Spleen here is, as you see, it is the largest lymphoid organ in the body, secondary lymphoid organ. It is located in the upper left hypochondrial region here, in the abdominal cavity. It's intraperitoneal organ. Its main function in adults is related to the destruction of all the RBCs. I mean, it is act as filters of blood, and also it has important immunological function where it produces antibodies against viruses and bacteria. So, as you see here, here's the main learning objectives. You can read by yourself. So, spleen has surfaces, borders, hilum. It also connected to the other abdominal organs by ligaments. It has nerve, blood supply, and lymphatic supply. Also, it has clinical importance related to some disease like accessory spleen and wandering spleen, which will be explained later. So here is a spleen in situ. As you see, here is a spleen. It is located in the left hypochondrial region here. It is below the left dome of diaphragm, where it's separated from the left lung and left pleural cavity. As you see here, the spleen has a visceral surface here and has diaphragmatic surface related to diaphragm above. Spleen also is, as you see here, here's the stomach, here is cut. So means spleen is here deep to the stomach, where it forms part of the stomach bed. And also, if you look here, here's the splenic hilum, which receives the splenic vessels, and also the tail of pancreas here. Here is the tail of pancreas. If you look here, some organs are deep to the spleen, yes, like left kidney here. And also, some organs are below the spleen, like left colic flexure here. Here is left colic flexure. If you look to the spleen here, spleen has notched upper border here, notched upper border. It has also lower border. It has here this end, we call it posterior end or medial end or upper end. And it has also here lateral end or anterior end or anterior or lateral end of the spleen, or you can say lower end. So, as I mentioned here, visceral surface related to the organs, and also here is diaphragmatic surface which is related to diaphragm. That's all regarding the general features of spleen. If you look here, spleen is related laterally, as mentioned, to the diaphragm. Here's the diaphragm here, okay? and also related to the ribs. Here's the ribs from 9, 10, 11, where the long axis of spleen is related to the rib number 10. That's clinically important because if there is some accident, for example, car accident, and the spleen is, and these ribs are broken, there is a great possibility of traumatic rupture of spleen and internal hemorrhage. So, means this surface you look from here is the diaphragmatic surface, or you can say costal surface, because also it's related to ribs. Here is the opposite side. Here is the opposite surface, which is visceral surface or medial surface, which is related to the organs and also which contain the area called splenic hilum, which receives the splenic vessels and also ligament here. This ligament called splenorenal ligament or lienorenal ligament, which connects the spleen to the left kidney and contains the tail of pancreas and splenic vessels. Also look here is a border which is notched here, and this notched border is the superior border, or you can say the upper border here. So means this is the lower border. So here is a diagram which shows the main surface and the borders, as I mentioned before. Here is the position of the spleen in the upper left abdomen, in the left hypochondrial region. Here is the upper border, which is notched. Here is the lower border. Here is the upper bowl, or you can say upper end, or medial end, or posterior end. And here is the lower bowl, or lower end, or lateral end, or anterior end. All of these are right. Here is the visceral surface, and here is the splenic hilum. Here is the costal surface or diaphragmatic surface. What else? Impressions. Impression is the spaces, or foci, or impressions which are related to the organs which are related or in direct contact with the spleen. For example, here, impression of the stomach. So it's gastric impression here, gastric impression here. Here is related to the body of the stomach and the greater curvature, of course. Here is the impression below, which is related to the here, which is related to the left kidney. Is renal impression. Renal impression. Here is the pressure related to the colon. As I told you, here is the left colic flexure. Here. So it's colic impression. And there is a impression of the tail of pancreas, which is, so it's pancreatic impression. So here is so in the practical exam, we can bring spleen like this and mark this surface by pen and ask you what is this impression, and for example, and or which organ is related to this marked area or impression. Here is the relations of the spleen. As you see here, of course, it's related to organs. It's related to organs. So, as I mentioned, I already mentioned this before. So, spleen is related to, from above and to the diaphragm, which separates it from the ribs and also the left lung and the pleura. It is anterior related to the stomach. Here is the stomach here. Here it's already cut here. Here is the stomach here. And because it forms part of stomach bed, so it's posterior to the, so spleen is related anteriorly to the stomach. It is related superior to the diaphragm and the ribs, and also inferior it is related to the colon or left colic flexure, and of course medially or posteriorly it's related to the left kidney. Also spleen is also related medially to the tail of pancreas. Here is just important information related to the spleen. I will not repeat, but as you see here, spleen is interperitoneal organ, so means it is covered by peritoneum. Spleen has, remember number 2 in relation to the spleen, it has 2 borders, it has 2 ends, as I mentioned, it has 2 surfaces, it has 2 important ligaments. One is called splenorenal or lienorenal, because line means spleen, and the other ligament called the gastrosplenic, which connected to the stomach. And each ligament contains important structures I will mention later on. Spleen also is, in adults it has 1 by 3 by 5 inches as dimensions, and also it weighs about 150 grams or 7 ounces. As I mentioned, it lies between 9 and 11 ribs. Spleen, when it becomes enlarged, we call it splenomegaly, or splenomegaly means enlarged spleen. And when it's enlarged, it can be felt under the costal margin. Normally, the spleen is not felt; it's felt only when it's large. It's enlarged, and of course, when it's enlarged, like in some disease, like for example, hemolytic anemia or cancer, blood, its notched upper border will be felt by hand. Here is the impressions related to the spleen, and I think I talked about it in the previous slide. And also here is the splenic hilum, which receives the splenic vessel, splenic vein, and splenic artery, and also attached to 2 ligaments. One is called splenorenal ligament, which connected to the left kidney, and this ligament contains 10 of pancreas and splenic vessels. The other ligament is gastrosplenic ligament, and this ligament connect the spleen to the stomach and contains the short gastric vessels and the left omental vessels. Here, peritoneal attachment, I talked about. I just mentioned now about the 2 ligaments of the spleen, which is related to the hilum. One is called the gastrosplenic. Other one is called gastrosplenic ligament, and also lienorenal, which connected to the spleen to the left kidney. There is also another ligament called, but it's not attached to the hilum of the spleen. This ligament is called pharyngeal-colic ligament, pharyngeal or pharyngeal-splenic ligament. This ligament is related to the left colic flexure, and it is support the spleen from above. So it prevents enlargement, and it prevents downward displacement of the spleen. It's called pharyngeal-colic ligament. Pharyngeal-colic ligament. This regarding the ligaments. Yeah. So this pharyngeal, as mentioned, this pharyngeal-colic ligament supports the spleen inferiorly. When the splenic ligaments become lax or become elongated, the spleen go down here, down to the pelvis, and in this condition it's called wandering spleen. wandering spleen. And it's clinically important, and it is a patient suffer from pain in the lower abdomen. Here is the blood and the nerve supply of the spleen. As you see here, spleen here is supplied by these tortuous arteries which pass behind the stomach. This is called splenic artery, which is a branch from celiac trunk. This artery is tortuous or wavy, and this artery supply the spleen and terminate in the hilum of the spleen in 5 or 6 branches. These branches divide the spleen into segments, and every segment is supplied by one branch. And that's clinically important if we do what's called partial splenectomy, where we remove only one segment and supplying and ligate the supplying branch of splenic artery. Splenic artery also not only supplies the spleen, but also give branch to the pancreas. We call it pancreatic branch of splenic artery. Splenic artery also give branch, which is called short gastric arteries, to supply the fundus of the stomach here, and also it gives the left omental or left apoplectic branch, which supplies this area of the stomach, which is close to the body and greater curvature. Accompanying the splenic artery, as you see here, is passing above the pancreas. On the splenic vein, as you see here, here is the pancreas is cut. So his splenic vein is the remaining part of the pancreas. Splenic vein here pass deep to the body of pancreas, and of course it starts from the hilum of the spleen and pass deep to the body of pancreas, where it joins the superior mesenteric vein here behind the neck of pancreas, forming the portal vein, which terminate in the liver, inside the liver. So that is regarding the blood supply of the spleen. The spleen also has draining lymph node, which is called splenic or pancreatosplenic lymph node here, which drain finally to the celiac lymph nodes around celiac trunk. Here is the CT of the of the spleen. As you see, here is the spleen here. Here is the spleen, and here is the stomach, and here is the liver. How to hold the spleen in your hand in the anatomical position? So put your thumb on the notched upper border of the spleen. Put your other fingers at the lateral end or anterior border of the spleen. Put the medial end toward your wrist. That is the anatomical position of the spleen, where it's held. You can carry it or you can hold it by your left hand. The spleen also has nerve supply, of course, and many sympathetic nerve supply, which is rising from sympathetic trunk, and this sympathetic supply to spleen is vasomotor. Here is the surgical anatomy of the spleen. The most common pathology related to spleen is splenic rupture due to traumatic rupture of the spleen, and which is accompanied by severe internal hemorrhage. And so in this condition, the spleen, if it's ruptured by accident, we have to do emergency splenectomy or removal of the spleen by midline incision through the linea alba, and then we divide the ligaments at the hilum of the spleen, which is lienorenal ligament, and also we ligate this ligament is ligated, and we ligate the splenic vessels, but we have to avoid damaging the tail of pancreas because it's passed through this ligament. And in this condition, we remove the spleen, but before we remove the spleen, maybe in some condition, we have to squeeze the spleen by the hand to evacuate the blood before its removal, and we call it autotransfusion. Spleen also can be removed by elective procedure, not emergency. It's like splenomegaly in hemolytic blood disease, or splenomegaly in some disease like bilharziasis. So in this condition, we do a left paramedian incision, and just we open the lesser omentum and access the spleen behind the stomach, and then remove it after ligation of splenic vessels and doing autotransfusion. As I mentioned, here is the small spleen, we call it accessory spleen, and this accessory spleen is due to formation of splenic small spleens, spleenules, which didn't fuse. That's why, if I ask you why is the upper border of the spleen is notched, this is because the spleen developed from mesoderm during intrauterine life, and then at the this mesoderm like balls, and then at the site of fusion there is notches. If there is failure of this fusion, there will be accessory spleens like this one, like this one. It could be 1 or 2 or 3, and usually it's found at this splenic hilum or at some area like gastrosplenic ligament or linearenal ligament. And these accessory spleens should be removed in case of some diseases like hemolytic anemia, where in hemolytic anemia, spleen should be removed because it is the source of anemia. But if you forget to remove the accessory spleen, it will grow again and inducing the same disease. So be careful. You have to look at accessory spleen if you do splenectomy for hemolytic anemia. That's all. Thank you very much, and I hope you enjoy my video, and see you. Bye-bye.